Crying babies and shaken baby syndrome. A baby cries and that's normal. In fact, crying is the only way an infant can communicate, and it is their first sign of life. This is part of their normal development, and the primary goal is to attract the attention of their parents or caregivers. Crying begins around the 15th day of life, peaking at 2 months, with a maximum duration of 6 to 8 weeks, then decreasing and stabilizing by 12 weeks. Crying mainly occurs in the late afternoon and evening. On average, a baby cries for 2 hours a day. When a baby cries, it is important to check certain things first. Is he hungry? Is his diaper dirty? Does he have a gas? Does he have fever? Is he too hot or too cold? Does he have been overstimulated during the day? Is he tired? In most cases, there is nothing serious, but the repeated crying of babies can be difficult to bear, especially for tired adults. Various methods exist to soothe a baby's cries. For example, changing position, lay him on his stomach for about 5 to 10 minutes while regularly monitoring him, since there is a risk of suffocating the head. He should not fall asleep on his stomach. Folded legs on the stomach, arms crossed, change his diaper, hold him in your arms and rock them, sing, talk to him, play music, put him in a baby carrier, take him for a walk or a car ride, massage him, place him in a quiet room with a comfortable temperature and soft lighting. On his back and walk away. You can close the door to reduce noise, but check on the baby regularly about every 10 minutes. Why? Because we shouldn't hold the baby when we are hungry, as checking can occur, even unintentionally. What is shaken baby syndrome? A baby has a large head and weak neck muscles. Babies cannot control the head and cannot resist or minimize the force of movement. When a child is shaken, his brain moves back and forth, causing veins to tear, leading to bleeding in the skull. This can result in brain bleeding, eye bleeding. It can also cause swelling in the brain. Most of the time, there are no external signs, meaning no bruising. Fractures of ribs, thighs or arms can also be present. Each year, 20 to 75 babies under 1 year old out of every 100,000 suffer from shaken baby syndrome. Shaken babies are most often boys, typically under 6 months old. A baby is usually shaken about 10 times, but once is enough to cause permanent damage. The perpetrators are most often the father, then the mother's new partner, babysitter, and then the mother. How to suspect that a baby has been shaken? The baby is drowsy, exhibits marked fatigue, has a fever, is irritable, has morning vomiting, shows signs of distress, has seizures, has trouble breathing, a drop in weight and height growth, an increase in head circumference on the health record. What are the long-term consequences? 25 to 50% of parents are unaware of the harmful effects of shaking a baby. Deaths: 20 to 30% of child deaths are caused intentionally. In 21, 1,300 children died from shaken baby syndrome. It can also lead to disabilities, reduced brain volume, spinal cord problems, paralysis on one side of the body, loss of vision, balance problems, delayed psychomotor development, language disorders, difficulty with expression, inability to perform intentional movements. The long-term prognosis is worse if the child is very young and if the injuries are widespread. So, what should you do? Go see your doctor either in a private office or at the emergency room for the child's evaluation and take the necessary legal steps to ensure the child's safety. A baby crying is normal. Feeling frustrated or tired from their crying is normal, but it is important to pass the baton because shaking a baby, even just once, can have irreversible consequences or even cause the baby's death. This information needs to be shared with young parents and their loved ones, knowing is protecting.